Hi, this is Dr. A, and I'm here with your Intro to U.S. Healthcare System lesson, and we are going to look at social legislations and health literacy. So let's start with social legislation and give you some examples. So first, social legislation or social regulations are rules and regulations that protect consumers, and they usually have been put into law. So most of these are at the federal levels. There can be some that are done at the state level also. So we're going to look at some key ones. The first one is the Sherman Antitrust Act, named after the senator that put it forth. And it's an antitrust law which prescribes the rule of free competition among those engaged in commerce. So this applies to all industry in the U.S., including healthcare industry. And the Sherman Act outlaws every contract, combination, or conspiracy in restraint of trade and any monopolization, attempted monopolization or attempted to monopolize, or conspiracy or a combination to monopolize. And so this is to ensure that you have choice in your healthcare providers. And so because of the Sherman Antitrust Law, you can't combine, like, all the hospitals in, let's say, in the city cannot be owned by the same entity. And so it would prohibit one hospital from acquiring another hospital across town if these are the two only hospitals, for example, in that city. And so that can drive competition then, and that keeps fair wages, fair prices, and other things like that in place for the industry and for this aspects of what we're talking about, the healthcare industry, although it does apply to all U.S. industries. The next social regulation is the Newborns and Mothers Health Protection Act. So this is a federal law that affects the length of time a mother and newborn child are covered by health insurance for a hospital stay in connection with childbirth. And so the law states that coverage can be no less than 48 hours following a vaginal delivery or 96 hours following a delivery by cesarean section. And so they cannot send you home before those allotted hours have passed. And you have to have plenty of time to recover. They can keep you longer, but just cannot keep you less than that. The next one is the Women's Health and Cancer Rights Act. It's a federal law that provides protections to patients who choose to have breast reconstruction in connection with a mastectomy. So this is for our ladies that have had breast cancer and have had to undergo a mastectomy, and then maybe want breast reconstruction. They want an implant or something to balance their breast out, or to have them if they were both cut off. And as you know, I'm sure that, breast reconstruction or breast augmentations or things tend to be elective surgeries. And so this act passed saying that if this is not an elective surgery, because who elects to have breast cancer, right? And so if you have breast cancer, you have a mastectomy, then the insurance should cover breast reconstruction. The Mental Health Parity Act is a federal law that prevents health insurance issuers that provide mental health or substance use disorder benefits from imposing less favorable benefit limitations on those benefits than on medical surgical benefits, which basically says that if the insurance service, the insurance provider covers mental health, they need to cover it in the same manner as they would cover medical benefits. And so, like, if your copay for a provider visit is $35 for a medical visit, it should be $35 for a mental health visit. So that's just an example. However, this is not telling the health insurance companies that they have to provide mental health services. Just as if they do provide them, the benefits need to be similar as the medical benefits. The next social regulation is the Genetic Information Non-Discrimination Act. So it protects individuals against discrimination based on their genetic information in health coverage and in employment. So let's say you do a genetic testing to see your ancestry or something, and you come back and there is evidence if you're female that you have the BRCA gene, or that you have Alzheimer's gene, or there's one of the disease genes that's been identified as seen in your genetic profile. Now, that doesn't mean that you will get breast cancer or Alzheimer's. It just means that you have a risk for it. And if that information was known by, let's say, a health insurance provider, then this law says they cannot charge you more based on that information. And the same thing, the employer cannot deny you employment based on that information in the fear maybe that you will cost them more with the health benefits. So there you go. So non-discrimination based on genetic information. The Lilly Ledbetter Fair Pay Act, it requires employers to redouble their efforts to ensure that their pay practices are non-discriminatory and to make certain that they keep the records needed to prove fairness of pay and decisions. And so this has to do with, being paid for, different types of jobs. But if we take an example, if you are hired as a nurse and you are straight out of school, you should be paid the same with, if you have no experience, whether you're a male or a female, or doesn't matter your race or whatever, there should be equal pay. And then as maybe if you're hired with experience, the amount of experience, how that counts, should be the same for everybody, how that's factored in. Anyway, so try not to discriminate against various entities when it comes into pay. And this was put into place because discrimination existed. And it was often seen that men would be paid more for the same job as a female would. And it was because back many, many years ago, they were seen as the providers for the family, and therefore they need to be paid more. And women were seen as, if they're working outside of the home, they were just supplementing their husband's income, so they didn't need to make as much. There's been discrimination with race, etc. So this helps to again, put it into law that it needs to be non-discriminatory. And the Affordable Care Act, also known as Obamacare, was enacted in 2010. It's a law that increases health insurance coverage for the uninsured and it implements reforms to the health insurance market. It had 3 primary goals when it was passed, and still does, to make affordable health insurance available to more people, to expand the Medicaid program to cover all adults with income below the 138% of the federal poverty level, and to support innovative medical care delivery methods that are designed to lower costs of health care generally, while, of course, maintaining quality. Okay, so let's talk health literacy. And so Title V of the ACA defines health literacy as the degree to which an individual has the ability to obtain and observe basic health information to make the best health decision for themselves. So how well can they understand the information that's provided to them by the healthcare providers? There are some rules that we have to use when communicating, if you're a provider, when communicating with patients, such as the literacy level that you use. You usually want to put things out at about 3rd to 5th grade level. So it has to be a lot lower than what you think so that your average person can understand it. And there are many things that come into play to affect health literacy. So it can be impacted by culture, by the complexity of the health system, which we have a very complex health system, and it's difficult sometimes for patients to know where to go for what and how things work. The ability of the health consumer to navigate these complicated healthcare system, and communication by the healthcare providers. So as providers, if we talk to our patients using a lot of complicated medical terms, the message is just going to go right above their head. They're not going to be able to understand. So it is important for healthcare providers to be able to break down these concepts into simple, everyday terms so that your average person can understand the information and then make a decision for themselves. The Department of Health and Human Services indicates that health literacy is based on the principles that, one, everyone has a right to health information that helps them make informed decisions, meaning they also need to be able to understand that health information, right? And the health services should be delivered in ways that are understandable and beneficial to health, longevity, and quality of life. And so we'll talk social justice for a minute. So social justice in healthcare focuses on the right of all individuals to have access to resources, including healthcare, which means then health equity for all cultural groups. So that is social justice, and so that is one of the goals within healthcare. So social justice can be, of course, applied to other realms of industry. And studies have shown that clinicians tend to have more negative attitudes towards people of color, or they can have unconscious racial bias among clinicians, has been shown to lead into poorer outcome, poorer communications, lower quality of care, and this is unacceptable. This also means that we need more representation within healthcare, so that people of color and people in general can find a provider that suits them, that they can relate to. So in conclusion, for the first chapter of Intro to U.S. Healthcare, the United States does not have universal healthcare coverage. It is the most expensive and complex system in the world. It has many sectors which must communicate with each other to provide quality healthcare. Health disparities exist across the nation as a result of social injustice, and this is very evident what we'll see in the next chapter in maternal and infant mortality rates, and there's a big, for example, disproportion between white and African American in that. And social justice needs to occur to eliminate health disparities which result in health equity. Or inequity. If there's health disparities, and there's health inequities, right? So, all right, so that wraps up our first chapter of Intro to U.S. Healthcare.